Welcome to Vallejo PT, Vallejo Physical Therapy Online. What's up, guys? Paul Kolaski, physical therapist, pain and movement specialist, and today we are going to take you through some of my secret tips and tricks for shoulder rehabilitation. All right, so these are things that are easy that you can do at home. Doesn't require a lot of equipment, but they provide a lot of bang for buck on getting yourself better. All right, so let's dive right in, guys. All right, so the first thing we're going to work on, so my sequence, all right, number one, sequence, all right, and how we work on getting any body part back, but especially the shoulder, right, has four parts. First one is going to be the warm up. All right, so we always want to warm the tissues up. All right, now with this particular program, I'm assuming that you are not post-surgical, so if you've got some surgical restrictions, stuff like that, check with your doc, work on that stuff directly with your therapist. This is more an active rehabilitation. You've already been cleared for that active rehabilitation phase. All right, so active warm up preferably, okay? So that means that you're doing something to move. With the shoulder, I like whole body. All right, as much as we can get in whole body warm ups, that's kind of the way I like to go. So, ideas for the shoulder on a whole body warm up: walking lunges, standing squats, going outside and going for a walk, starting your rehab right when you get back inside from being outside from a walk or working the treadmill, elliptical, or any of those devices. Anything that's kind of gotten your heart rate up, getting you moving, does a much better job than trying to slap a heating pad on something. Heating pads really not effective. That's why we don't use them in physical therapy anymore, at least in our clinic. We haven't used heating pads in years. Try to really focus on that dynamic warm up first. Okay, so try to make your warm up dynamic, number one. All right, number two, getting into that soft tissue work. All right, typically all of us have some soft tissue stuff that we need to work on. Doesn't change with the shoulder joint. All right, so if we're working on the shoulder, our hot spots, lacrosse ball. This is not a video for working the lacrosse ball. You guys can find that in other posts, or maybe in this blog post or in other YouTube videos. But the standard lacrosse ball, we're going to work the pec minor and the subclavius. Okay, so that's the muscle right here in the front, and then a muscle right here at the base of the clavicle. Interestingly enough, both of those muscles are accessory breathing muscles. All right, so a lot of times if we've already had some issue with our breathing patterning, these muscles can also get tightened up. Also, a lot of postural pec minors get tight with those shoulders forward, as does that subclavius muscle. Both of them cause referral pain into the shoulder, so good spot to hit. All right, next spot that we're going to go after is going to be the infraspinatus, or the rotator cuff muscles on the back of the shoulder blade. Again, I got great instructional videos on that. You can check that out. But that rotator cuff muscle back there tends to, again, as we work in that forward position, as a lot of us do, or if we're in that sling, right, for a long period of time. This is why sling position, guys, if you're going to use one, make sure that the hand is out here in this position, outside of the belly button, okay, not across the body. But working in front of us here with the desktop or a workstation, shoulders come forward. Not saying that we need to get obsessed about pulling the shoulders back, but just understand that as the arms go forward, they externally rotate. This muscle gets overly short, gets tight. We need to do some ball work on it. So ball work directly over that infraspinatus muscle on the back of the shoulder blade. All right, and for our soft tissue work, those spots are going to be 30 to 60 seconds in each spot. This is the first spot. This is the second spot. The third spot that we're going to do is a super trick, super secret area. It is the deltoid, and coming right off of that deltoid insertion and right in between the biceps and the triceps. It's not even a lot of therapists that know to work this particular area. All right, but if you can get in there with your lacrosse ball up against the wall, if you happen to do self instrument assisted soft tissue, I'll show a video on that in a little while. Instrument assisted soft tissue work right along that particular area. Tons and tons of improvement with internal, external rotation in our ability to get our hands pain-free over our head. So we started with our warm-up. We went to our soft tissue work. Now we got to activate something. Tip and trick on activation, especially if you're early in the rehab process. grip. Okay, yeah, there's lots of other exercises we can do, guys, but grip is a secret weapon when it comes to shoulder rehabilitation. I've got two examples here. I've got a standard Digiflex device here, and our typical grippy. This one here has a spring that can be adjusted in the middle. I tend to like this one a little bit better, both available on Amazon. I put the links in the post. But this one is highly adjustable, so even people with the early on rehab or even very weak grip can typically tolerate this one. This one here, if you need to do individual fingers, does great. Next secret on grip. Okay, a lot of people think, well, okay, grip right here in this position. All right, well, that's only one of 6 positions that we need to work on our grip with. All right, so I'll demonstrate with my right hand. So we need to do grip in the thumb up position, 10 to 30 repetitions, still slow and controlled, just like we do all our other movements. All right, then we're going to go to the palm up position, 10 to 30 repetitions, and then the palm down position. All right, this changes the length tension relationships around those muscles in the elbow. What's nice about using grip is that you have to activate all of the muscles in the shoulder blade. Grip has actually been highly associated to activation of the rotator cuff, the shoulder stabilizing muscles. So again, this is why grip is such a secret weapon when it comes to rehabbing the shoulder or making sure that we just have a good, solid shoulder. All right, so that was 3. 1, 2, 3 positions. Now we got to take the elbow straight. All right, same position. All right, down here, thumb forward, and palm back. So we got to work in all 3 or 6 of those positions with the elbow in those changed out positions. All right, guys. So that actually for grip covers our activation and our integration. All right, because integration, we typically say with integration in our philosophy, is that we then do some kind of functional activity. Nothing a whole lot more functional than working on grip. So we get to knock out two birds, one stone with that particular exercise. Cool, guys. So hope you enjoy that. You got any questions, hit us up. Otherwise, Paul Koloski, Vallejo PT online, and I'll see you next time. Thanks.